I'm Mohit Yadav. Can I know your name and age?
My name is Yadav. My age is 21 years old.
Okay. So, do you have any pain in your abdomen?
No.
Any problem in your stomach?
No.
Okay.
Before you examine the abdomen, make sure that the patient has emptied his bladder. Ask the patient to lie down and relax. Expose the supine patient lower abdomen by raising the t-shirt to below the nipple line and lowering the drape to the suprapubic level. Inspect the skin for scars, dilated veins, rashes, or ecchymosis. Inspect the symmetry and counter of the abdomen. Observe the counter of the umbilicus to look for signs of inflammation. Warm your hands and your stethoscope. Listen for bowel sounds by placing the diaphragm of the stethoscope gently over each quadrant. Listen to abdomen before performing percussion because these maneuvers may alter the frequency of bowel sounds occasionally. You may hear the normal stomach growling. If the patient has high blood pressure or atherosclerosis, listen in epigastric over the aorta. Then listen over the iliac arteries and femoral arteries. Next, lightly percuse the abdomen to access the distribution of tympani and dullness. Tympani is a high-pitched musical sound that indicates hollow space filled by air or gas in the stomach. Dullness suggests fluid or underlying organs like liver. Now palpate the four quadrants of the abdomen. Identify any tenderness, increased resistance to your hand. Ask patient to take deep slow breaths for me and just try to relax and palpate gently. Again, having the patient flex the knee is often helpful. Then palpate by pressing more deeply in all four quadrants as you feel for any masses or tenderness. Placing one hand on top of the other. Watch closely for signs of an acute abdomen from inflammation. Now percuse the span of liver. First locate the mid-clavicular line. Below the umbilicus region start the percussion. Percuse till the nipple region. Identify the lower border of dullness in the mid-clavicular line. Next, identify the upper border of liver dullness. Starting at nipple line, gently percuse from lung resonance down forward liver dullness. Measure the span of liver dullness between those 2 points. To palpate the liver, place your left hand behind the lower thorax, lifting 11th and 12th ribs. Place your right hand just below the right upper quadrant lateral to the rectus abdominis muscle. Press gently into the abdomen and ask patient to breathe deeply to feel for liver edge as it moves down to meet your fingertips. You need to try again moving your fingertips closer to the costal margins. The hooking technique may also be helpful. To access for tenderness, when the liver is not palpable, place your left hand flat on the right lower ribcage. Gently strike it with the ulnar surface of hand. Ask the patient to compare the sensation to other side. To palpate the spleen to access its size, reach over and around the patient with your left hand to support the left lower posterior ribcage. Place the right hand below the left costal margin and place in with your fingers towards the spleen. Tip of spleen is palpable in only 5% of normal adults. Alternatively, ask the patient to turn on the right side with the legs somewhat flexed at the hips. In that position, gravity may bring the spleen forward and the right into a palpable location to help detect splenomegaly. Precuse the left lower anterior chest wall roughly from the border of cardiac dullness at the sixth rib to anterior axillary line to down to costal line. This is an area called tragus. Space edges precose along this route, not the lateral extent of tympani. To palpate the left kidney, move to patient left side and place your right hand behind the patient just below and parallel to the right 12th rib with your fingertips, just reaching costovertebral angle. Trying to displace the kidney, anteriorly place your left hand gently in the left upper quadrant lateral and parallel to rectus muscle. Now ask patient to take deep breath. At peak of inspiration, press your left hand firmly and deeply into left upper quadrant, trying to capture the kidney between your hands. If kidney is palpable, access its size and counter and any tenderness. To capture the patient's right kidney, return to the patient's right side and use your left hand to lift up and your right hand to feel deep in the right upper quadrant. Proceed as before. Examining the aorta. To access the aorta, raise the upper abdomen slightly left of midline and feel for the aorta pulsation. Pressing gently with a hand on each side of aorta. Try to estimate its width. Normally should be less than 3 cm. With the patient sitting up, access for costovertebral angle tenderness. Place the ball of your left hand on each costovertebral angle. In turn and strike it with the ulnar surface of your fist. For shifting dullness, precosing the border of tympani and dullness with patient supine. Then turning patient onto one side and precosing again. Testing for a fluid wave by tapping one flank sharply with your fingertips while you feel on the opposite flank for an impulse transmitted through the fat. Palpate carefully for an area of local tenderness called McBurney's point, which lies 2 cm from the anterior superior spinous process of ilium on the line drawn from the umbilicus.